Jen, why are you coming in today? How can I help you?
About like 10 years ago, I found out that I had osteoarthritis. Or they're saying something like, they're calling it OA.
Okay.
And so recently I've been having this pain like in my shoulder. It's about like right around here.
Sure.
And like it comes and goes throughout the day, but I really believe that it just has a mind of its own. So like when it's at its worst pain, I would probably say it's probably about a like 10 out of 10. And when the pain isn't too bad, maybe 1 out of 10.
Okay.
But I take pain meds every day for it. But I just feel like it's not helping. So I went to the doctor and he sent me here to you. And I did research on you, well, on the facility and you too. And I read that you were the best. So I'm really just hoping and praying that you can help me with this pain. Because I really want to return back to work. I'm a CNA. And I had to stop working once my shoulder pain was getting worse because I wasn't able to reach forward to get the IV bag off of the pole. And so that was affecting my work, and now I can't go to work anymore. So I don't know, I just want to get rid of the pain.
That's fair. Do you mind if I just kind of reiterate some of that back to you, and you can let me know if I have it right?
Yeah.
Okay, so starting from kind of the beginning, I'm aware of your pain in your shoulder here. That kind of is a constantly there with you, but sometimes kind of goes up and down a little bit. The lowest being the 1 and the highest being the 10. So I can already tell you're kind of familiar with the medical system just by giving me those numbers you gave me.
Yeah.
So I know you've been through it a little bit, and I can understand that whole frustration process behind that as well. So I also can tell that it's affecting your work and quality of life and somewhat your emotions as well by you not being able to go back to work and doing something you love to do. Your main problem is reaching up for IV bags or overhead lifting is what I'm kind of gathering from that. And yeah, does that seem fair? That's your main problem that you're having, is just being able to reach overhead like that?
Yeah, you're right. Well, now that you're going over everything, I saw the doctor about 2 weeks ago, and he had me get an X-ray, and I went back for the follow-up, and he was saying something about like bone on bone.
Mm-hmm.
I don't know what that is. He just kept saying bone on bone, so I don't.
Would you like me to explain a little bit more of that to you? Or?
If you can, please.
Okay, so I did see your x-rays, and I saw how severe they were. They did look pretty bad, so I can understand how you'd be in a lot of pain with that. But first, I'd like to just get your understanding of what do you think's going on with that? Why do you think you have the bone on bone?
Could be the osteoarthritis. I don't know. I have no idea.
Okay, so yeah, it is. That's pretty much what osteoarthritis is. It's wear and tear of the bones. And do you know maybe why you might have that, or the cause of that? Any ideas on what you might think that it kind of came from?
Well, it could be hereditary. I know that my great-grandpa and my brother's wife, they have osteoarthritis. So it could be hereditary.
Sure. That's definitely one possible cause of it. However, if you're up for it, I could provide you with another explanation that might make some sense.
Okay.
Just by how you're sitting, I can see maybe your posture might influence that a little bit, or just that repetitive motion of what you're doing with maybe this poor posture, or you're tired at the end of the day. Sometimes posture and body mechanics of how we do things can play a big part in that role. But kind of going back to the x-ray, in order for me to help you a little bit more, I'll need to gather a little bit more information from you. So would you be up for that? Just a few more questions as far as giving me a little bit more information so I can better help you with this shoulder pain?
Yeah.
So you said that it goes up and ranges from that 1 to 10. But how long does that kind of stay with you, that pain, after you were to lift your arm up and grab something or hang the IV bag?
I'll say just when I'm in that motion.
So as soon as you get out of that position, it kind of goes back away?
Yeah.
Can you give me a rough time frame where, 5 seconds, 10 seconds, 2 seconds? Or is it as soon as you're out of the position?
Probably as soon as I'm out of the position. That's when the pain would go back to the 1.
Go back to the 1. And up to the 10 when you're in that position?
Oh yeah, I feel that pain kills me
Okay.
when I have to reach up for that. That's why I've been trying to avoid that motion, because I feel like if I keep doing that, I'm going to get inflammation in my shoulder, and then I'm not going to be able to move my shoulder at all. So that's what I'm afraid of.
Yeah, that would be frightening. And you're going to need your shoulder for the rest of your life. So would you be up for having me put you through a few more tests and measures to see if I can get a better idea of what's going on with the shoulder so I can better help you?
Yeah, anything to try to get rid of this pain.
Okay. So Jen, I'd just like to see that functional movement of what you're doing at your job to see kind of how that affects the shoulder pain. I want to get more of an idea about the pain. Okay, so can you show me what you would do at work and try and replicate it the best you can?
Are you going to help me though? Because
I'll-
I haven't done it for a while, because I'm afraid that if I bring my arm up, it's going to get inflamed or swollen, and it just hurts a lot.
Sure,
Would
well,
you be able to help me?
let me give you a metaphor that might help you understand. I know you're a CNA, and it's like, imagine trying to push a patient in a wheelchair with one brake still on. It's going to be hard to move them, right?
Yeah.
So what I'm going to do with some of the interventions here is going to unlock that brake for you and make that a little bit easier to move. So I know it's going to hurt now, but I need to get an idea of how much pain and where the pain is, and more of the characteristics of the pain, so I can help you more. So yeah, it might cause you a little pain now, but it's only going to help you down the road because it'll give me a better idea how to help you.
Okay. Well,
Okay.
I'll try.
All right. So let's try it and see what we can get away with. So if you just want to, just imagine you're hanging that IV bag,
Okay.
and I want to see how you would do that.
It's right in here, and then when I come back down, it'll go away.
Immediately, or how long?
When
Is
it
it
stops?
still with you now, the pain?
Oh no, yeah, it goes away immediately once I get out of the position.
And raising it up, was that 10 out of 10?
Oh yeah.
And how many times throughout the day would you say you have to do that repetitive motion?
Maybe like 2 or 3 times, because I have to get dishes out of the cabinet. I also have to get my pain meds. I take those every day for my shoulder pain.
Let's keep it to what you're doing at home. You say just about 2 or 3 times a day at home, only getting dishes once or twice out of the cabinet.
Yeah, try and cut back on eating.
Okay. So that's a good baseline measurement. That's what I needed to get from there. And unless you had any questions for me, we'll go ahead and continue this exam on the table.
Okay.
You okay with that? So laying on your back, face up, with your feet down at this end. Alright Jen, so I'm just going to take you through a series of movements, just trying to assess how much your joint wants to move by itself, okay? I just need you to relax completely, and I'm just going to be doing all the work for you here, okay?
Oh, good, okay.
I'm going to do everything on this side first, just to get an idea of what normal is, alright? Now, scoot this pillow over a little bit, so it doesn't get in the way of what I need to do. Thank you. Any pain with that?
No, just stretch.
Okay. And where were you feeling that stretch? Alright, good. No pain with that one?
good side.
I know. But sometimes that poor posture can kind of lead to things on the other side as well. So I'm just trying to get an idea of how much this other side is affected.
Oh.
Okay.
I knew I went to the right therapist. You're so good.
You're in the right place, and you're making the right moves to start making a positive change here. We have to all start somewhere. Good. And I will remove this pillow just for this next one. And arms kind of just folded on your stomach there. Good. One last one, maybe scoot a little bit closer to me here. That's perfect there. And I will need to just kind of place my hand on your rib cage just to stabilize a little bit. Is that okay with you?
Just don't break a rib.
Okay. I promise not to break a rib. Okay, I'm going to do the same exact thing on the other side. Do you think that'd be alright?
Okay. We'll see.
Let's see what we can do, okay? Because remember, it just gives me more information to try and help you.
Okay.
Okay, so if you want to scoot over to the other side of the table, and knees will stay up just like they are. Let me know if anything hurts here, okay? I'll be a little bit more cautious.
See, that's pain right there, right in the front.
Okay. Anything else, or is that the only pain that you feel with that?
No, just this pain.
Right in the front?
I feel like a small stretch, but the pain's a lot.
Where are you feeling the stretch? Can you point?
The stretch?
Let's take you out of the position a little bit, and then tell me where you're feeling that stretch.
Here. My side.
Okay, that's a normal sensation. That just means we have a tight muscle. But this pain, I'm a little more concerned with that pain. But let's keep going with this exam, okay?
I think it's that bone-on-bone thing. Whatever that doctor was talking about, I think that's what it is.
So let me try and give you something you can think about to help you understand that pain a little bit more. So imagine an old cabin that's left in the wood and you haven't gone and visited it in a while. There's going to be a lot of spiders in there, right? Creating all these webs everywhere.
Oh, yeah.
So the reason those webs are there is because you're not in the cabin moving around and getting things out of the cupboard and dusting off all those spider webs. So that's kind of like the shoulder. You haven't been in that cabin in a while, moving around. So it's got a bunch of webs in here that are creating kind of that feeling where you can't move it through the whole range. So what my goal is in therapy, and our goal is to clear out some of the spider webs and get that joint moving a little bit better, more freely, so you're not running into webs all over the place. Does that make sense?
Okay, so what you're saying is, since I haven't been reaching for things as often, that's why I'm having that pain right now when you're going into
That's
motion?
part of the condition of osteoarthritis, yes, but I think some of the posture is contributing as well. That's why I'm trying to get an assessment of more of the posture and tight muscles that could be playing a part with it as well.
Okay, yeah, that makes sense.
Good. So is it okay if I continue with my exam here?
Yeah,
Okay, great.
you're doing a great job.
All right.
Really good job.
Excellent. I'm glad you're okay with this.
Just get that pain in the front.
Okay. And when I take you out of the position, does that pain go away?
Oh yeah.
And how high up was that pain? Did it go on that 0 to 10 scale?
Probably about like a 7. Not as bad as that first one that you were doing.
Okay. I'm going to do the same thing down here. Let me know how this affects that pain, if any at all.
Good.
Okay. Just a few more tests, okay? You're doing great.
Just a little bit of pain in the front still.
In the front still?
Yeah.
And I will need to stabilize your rib cage again. Is that all right with you?
As long as you don't break it.
Okay. Just let me know if my pressure is too firm. You okay with that?
Just feel a stretch.
And where is that stretch?
Right here.
Let's try and go a little higher. Oh, I'll do it there. And where are you feeling that?
Just in the front right there. That's about like I'm gonna let that 7 again.
Okay. All right, Jen. So I saved one more muscle test for the last one because I think it might cause you a little bit of pain. Okay. So let's see what we can get away with, but I think it's gonna contribute a lot to the interventions we need to do with you.
Okay.
All right. So just again, let me know if there's any pain with this. I will need to place my arm on your kind of rib cage here. Is that all right with you?
The pain's starting to increase.
And again, that's your pain in the front.
Yeah.
And that was that. How high did that go on that scale?
That's going up to about 9.
Go ahead and relax the arm. Good. Okay, Jen. So you can sit up here. I want to just explain to you kind of what I found and what you think maybe the best approach to the therapy is. Okay. So that anterior pain in the front of your shoulder, that's due to the fact that you don't have enough range of motion up there. So what I'd like to do is give you some more range of motion. Do you think you'd be all right with that?
Yeah.
And I also found there's some tight muscles that are limiting how high you can reach up overhead. So I want to also incorporate some stretches into getting you some more range of motion that way as well. So we'll address the joint and we'll address some muscles to help get you more range of motion.
Okay.
Okay? So would you be okay with me performing a technique to give you some more of that? Kind of all in one?
Yeah. Yeah.
All right, so I'll have you lay back down on the table. Knees will stay up. I can give you something to make you a little more comfortable here. Okay? And we'll scoot towards me a little bit. There we go. And now let me grab a towel. Thank you. You okay there so far?
Yeah.
Okay.
Still a little bit of pain, but it's okay.
Right. Well, this technique it might cause a little bit of pain, but understand that it's causing you pain in order to get you that more range of motion, which will take away your pain.
Okay.
Okay? So just try and relax. I'll have the arm. Go ahead and relax. Any pain with that?
A little bit, but you can keep going.
How about there? When I pull it apart?
A little bit.
You okay with that?
Yeah, when you go backwards, it goes away, and then it comes on, goes away.
And how about when I take you out of that position?
Yeah,
Does
it
the pain
goes
go away?
Yeah.
Okay. So like I said, we will kind of need to push through that a little bit, okay?
Okay.
But understand it's going to help this in the long run.
Okay.
Okay. So let's go ahead and reassess. Remember that what we did at the beginning? Like you're hanging that IV bag?
Oh.
Let me see you do that to see if this technique that I did helped you.
Okay.
Let's stand up, yep, and do it the same exact way.
Okay, so reaching up. I still have that pain, but I can reach a higher pole.
So you notice that too.
Just a little bit higher.
Good. So what do you think we should do now? Did you find that technique effective?
Yeah. Yeah, because I have more, I can reach up higher. But I don't know how I'll be able to do that, so I think I need you to do that for me.
Great. I'm glad you suggested that. I can give you some ways you could possibly do that at home, that same technique, or at least ways to help you maintain what I just gave you now.
Okay.
Would you be interested in some of those?
Yeah.
First, do you have any ideas on how you might do that at home? Something
Um,
similar, like to what I just did? Recreate that?
No. You're the doctor, so that's what I came to you for.
Okay, fair enough. Well, I can show you a few techniques and you can take your pick on which one you think might be the best and easiest to work into your schedule and the easiest for you to do.
Okay.
Are you up for that?
Mm-hmm.
Okay. So this first one, let's just go ahead and use this pole since it's sitting conveniently right here. So what I want you to do is we'll just reach that left arm up, the same way, as high as we can go. And we're going to just do that same thing, to where we can kind of just go into the pole. We'll feel that same nice stretch here. You can kind of rest your hand up a little bit higher and kind of squat down a little bit to get that traction, pulling the joint apart like I was doing. Did you feel when I pulled your shoulder apart a little bit?
Yeah.
So that's how you can recreate that here. We'll grab onto the pole and we'll squat down a little bit and just kind of go back and forth into that. I want to see how long you're able to hold that position. So let's try that right now. We can do it together.
So reach up. Okay. And then
Yep.
what do I do now?
You're just going to hold that. I want to see how long we can kind of tolerate that.
Okay.
Does that feel somewhat reminiscent of what I was doing with you on the table?
Yeah. Yeah.
Good.
A little painful.
Okay.
Can I stop now?
If you need to, yeah.
Yeah.
Okay, so we got about 20 seconds there. Let me know when the pain calms down.
Oh, it's gone right now.
Do you think, would you be up for trying that again?
Right now? Okay.
Let's try that again. That's looking good. That's looking good.
Okay, I'm gonna stop.
Okay. That was pretty consistent. Another 20 seconds there. So how many times do you think you'd be able to do that at home?
Maybe about like 4 times.
4 times? And that's throughout the day or all at once? How would you suggest?
All at once?
Okay. So Jen, you said you'd be comfortable doing that 4 times a day.
Yeah.
Is that correct? So I'd like to see. Do you think that's enough for you to be able to do in one day?
I don't know. You can decide.
Yeah, I'd like to see you do it a little bit more, just to help make sure you keep that range that we're getting. That way we can progress you to new levels quicker, if you're able to keep that range. So I'd like you to try and do that at least 5 times a day, doing 4 distinct bouts. Excuse me, the 4 bouts of the 20-second stretches,
Okay.
5 times a day. Does that make sense?
Yeah, I'll try.
So you're going to do that same 4 20-second hold 5 times a day.
Okay.
Okay, does that seem realistic?
I could try. See how we do.
Okay. Well, let's sit down and just some couple things to conclude with here. Do you have any questions for me currently?
No. Alright, no.
Okay. So I just want to end by seeing how, first off, how effective you think what we did here today was on a scale of 0 to 10.
Well, I give it a 10, because I feel like my pain is a lot better. So hopefully I can come to therapy every day, if that's okay with you.
Well, unfortunately, my schedule nor your insurance, I don't think will be too happy with that.
Really?
But like I said, I can give you some effective tools for you to be able to do this every day. But you're going to have to kind of take some of the reins. It can't be all me in this. I'm going to need you to be part of the team
Okay.
in your healing process. Is that reasonable?
Yeah, I'll try.
So we can make sure you're up to speed and have a good idea of what you need to do, but I definitely need you doing some things at home as well.
Okay.
Okay? So you said that you thought the therapy was effective.
Yeah.
How about your confidence with your ability to do this at home on that same 0 to 10 scale? Do you feel confident in doing this?
Yeah. Yeah, I'm gonna do it at home. Probably, I feel like I'm at a 9.
Is there any way I can make you get to that 10 on this one?
I don't know.
How could I
I just
make you
feel
more
like
confident?
I just feel like I'm never gonna be able to be a CNA again because of this pain, and I know I've lost a lot of friendships because of my frustration and anger with my pain. So it's just really discouraging.
Yeah. I can see that. I can understand that. So there is going to get better with time. As you continue to move the shoulder more, you're going to be more confident with that. And I imagine you're going to have some overflow into your relationships as well, and get back to being yourself. So just stick it out. We have to, it took time to get you in this condition in the first place, so it's going to take time to get you out of it as well.
Okay.
So is there any way I can make you feel more confident with these exercises? You said you're about a 9. I'd like to have you at that 10 before I set you on your way today. Or do you think eventually we might be able to get to that 10?
Yeah, I'll be able to get to the 10. I'll be able to get there.
Okay. And my last thing is, how important do you feel these exercises are as far as your overall health and recovery? On that same 0 to 10.
A 10, because I want to be able to go back to work and just have my life back again. Be able to hang out with friends and family without having to complain about my shoulder all the time, because I know that they don't understand my pain.
Yeah, it's a pretty intense pain. A lot of people don't get that. So I feel good about where we left with the home exercise program. I just want to explain to you kind of how I see us progressing therapy in the future. Okay, so I'd like to spend at least, if you're doing things at home regularly, I'd like to see us do that and get that range of motion back up to normal in the next week, 1 week to 3 weeks, depending on how aggressive we can be with it. And after that point, I'd like to get you strong to make sure you're able to hold yourself in that new range that we're giving you.
Okay.
So that might take an additional 6 to 8 weeks of just strengthening you after, to make sure you have muscles to kind of decrease the load of those two bones coming together. Because remember, you saw that on the x-ray, it was bone on bone. If we can get some of the muscles stronger to take the load off the two bones coming together, then it'll help decrease that pain you're feeling.
Okay.
So it's not so much about helping you with the pain. I want you to realize that some days it'll be worse than others, but what we're going to really long term do is just help you keep that range of motion and make you more functional.
Okay.
Okay? So do you feel good about leaving things the way they are?
Yeah.
Alright, great. Well, I'll see you next time.
All right. Thank you. Or maybe he should have.